Hi, my name is Rachel Gillette. I'm going to talk about Alzheimer's dementia for Nursing 341 Patient-Centered Care. In this presentation, we will cover the definition, risk factors, signs and symptoms, the diagnosis of Alzheimer's dementia, diagnostic tools, stages, and treatment of Alzheimer's dementia. What is Alzheimer's dementia? Alzheimer's dementia is the most common type of dementia, which did not become commonly diagnosed until the 1970s. Alzheimer's disease currently plagues 5.4 million people in the United States. This number is predicted to rise to 11 to 16 million by the year 2050. So what is happening to the brain of a person with Alzheimer's? As we age, the hippocampus of our brain gradually loses volume. This portion of the brain is responsible for learning and memory. In persons with Alzheimer's, the loss is much more rapid. The loss is even more rapid in those with vascular issues or diabetes. Another occurrence in the brain is the presence of beta amyloid plaques and neurofibrillary tangles. Plaques build around the brain's neurons, and the tangles build in the nerve cells, causing the neurons to die. The beta amyloid plaques are the hallmark marker of Alzheimer's disease. Let's talk about the prevalence, risk factors, and demographics. The main risk factor for the development of Alzheimer's dementia is age. A person's risk doubles every 5 years after the age of 65, and by 85 years old, more than half of people will have symptoms of the disease. Family history also plays a role in the risk of developing Alzheimer's. Persons with a first-degree relative have an increased chance of developing Alzheimer's, and those with several first-degree relatives with Alzheimer's have an even greater chance of developing the disease. Though these risk factors are non-modifiable, there are several modifiable risk factors that may help prevent Alzheimer's. One modifiable risk factor is head injuries. Though we cannot always prevent them, making good safety choices will help, such as helmets, seat belts, and prevention when possible. The vasculature health also has much to do with the development of dementia. Therefore, lowering cholesterol, not smoking, eating well, exercising regularly, maintaining an ideal weight, and managing hypertension can help prevent Alzheimer's. What are the signs and symptoms of Alzheimer's disease? In addition to memory loss, confusion, trouble with language and reasoning, persons with Alzheimer's may also display agitation. Agitated behavior is common in people with Alzheimer's. 24 to 45% of non-institutionalized patients and 85% of institutionalized patients may display agitated behaviors. They may also have difficulty with their emotions, hallucinations, delusions, and dietary and nutritional declines, as well as difficulty swallowing or dysphagia. Diagnosing Alzheimer's. After initial signs of cognitive impairment are reported to the family physician, it is required that another symptom be present, including impaired executive function, aphasia, apraxia, or agnosia. It is also important that the provider collects a reliable history, evaluates the patient's medications, and rules out all other causes of cognitive impairment. The provider may also prescribe a CT scan or an MRI to rule out any other causes of cognitive impairment. At this point, the primary provider does not note any other contributors to the person's cognitive decline. They may refer them to a specialist for final diagnosis. There are various new technologies coming for the early detection and diagnosis of Alzheimer's, such as new brain imaging, looking for biomarkers, and the testing of spinal fluid. In the lower right-hand corner, there is a picture of an MRI of a patient with a normal brain and a patient with Alzheimer's disease. Diagnostic tools. Several diagnostic tools are commonly used, such as the Mini Mental Status Exam or the St. Louis University Mental Status Exam, the SLUMS, the Mini-Cog, the MOCA, or the clock test. In the bottom right-hand corner, there's 4 examples of a clock test that are done incorrectly. Some of them don't have hands. Some of them, the numbers are not presented correctly. You just ask the patient to draw a clock, and this is an easy way to evaluate their cognitive status. There are 3 stages to Alzheimer's dementia: mild, moderate, and severe. In the mild stage of Alzheimer's, we notice subtle changes: memory loss, slight difficulties in the activities of daily living, difficulty with finances, odd behaviors, increased anxiety, less social. At this point, we may notice that the person is having difficulty balancing their checkbook, or they put their car keys in the fridge. In the moderate stage of Alzheimer's, we notice increased confusion, trouble with numbers, language and reasoning, agitation, anxiety, hallucinations, paranoia, delusions, and repetitive questions. At this point, we also start to see sundowners. Sundowners is when the patient has increased confusion or agitation at nighttime. They may be fine throughout the day, and then in the evening hours, they become agitated and confused, as well as disoriented. For nurses, we see this often. The patient is wonderful for 7 to 3 shift, and 3 to 11 comes in, and the patient is exit seeking and looking for his wife and trying to get out the door and agitated and hitting staff. And this seems to go away during the daytime hours and presents only in the evening. That's sundowner syndrome. And then the severe stage of Alzheimer's, we notice incontinence, loss of recognition for loved ones, weight loss, dysphagia, unintelligible speech, and at this point we start to see contractures and pressure ulcers. So how do we treat and manage Alzheimer's dementia? Unfortunately, there is no cure or real treatment for Alzheimer's. There are several medications that we can give to slow down the disease progression and help to alleviate symptoms. These medications include Namenda, Aricept, Exelon, Razidine, and Namzaric. But most treatment is planning, alleviating the stress on the person, and assuring their safety and managing symptoms. In the care for patients with Alzheimer's disease, routine is really important. Programming so that they know what to expect, what time we do things, and they're not disoriented. So a lot of times we see when we take a patient out of their home and put them in a hospital setting or a rehab setting, or we first transition them into long-term care, it can be very agitating and disorienting for them. So the best thing we can do is not try to medicate that patient or sedate them, but to just work with them to try to keep them calm and reorient them so that they understand what's going on. Overall, Alzheimer's has 3 stages: mild, moderate, and severe. There is no real treatment or cure, and the best thing we can do as nurses is to care plan for this disease, as well as for the caregivers involved in this disease process. There are the references used. Thank you very much.